Tonight, we're learning more potential cuts coming to Medicaid. Tomorrow, the Department of Health and Human Services will ask the Budget and Control Board for permission to run a $228 million deficit for the rest of the budget year. If the board doesn't okay the plan, the agency says it will shut down payments to doctors and hospitals, stop paying for adult dental, vision, and hospice services, cut drug benefits for diabetics, and home health visits for the elderly and disabled by a third.
And many of you are a part of these programs, and if services are cut, that could certainly affect your health. News 13's Mason Snyder has reaction in tonight's top story. Mason?
You want to do it in red or green?
Working on crafts is a normal thing for more than 50 disabled adults at the Active Day Adult Daycare Center.
These are individuals, either elderly or disabled, young adults or elderly adults who depend on us.
Like 30-year-old Michael Jarvis, who lives life with cerebral palsy. The Jarvises use Medicaid to pay for the daycare program, which allows his dad to drop him off during the day. An assistant also comes to the Jarvises' home in the evenings to help out with Michael's care.
I don't get home till about 5:30, so there's no one there, and he can't be home by himself. I mean, if the house caught on fire or something like that, he couldn't get out.
But thousands like the Jarvises face Medicaid cuts if the state deems necessary to make up for a small part of the much larger budget deficit. And those making the cuts say it's not even a good long-term solution.
Some of these reductions might actually end up driving long-term costs upwards, and that's not a good thing. Unfortunately, we do not have the luxury of thinking long-term right now. We have to think in terms of what can get us short-term savings.
Hospice care also faces being wiped away altogether.
It is going to put, financial strain on the people, us that provide this care. We count on Medicare, we count on Medicaid.
Have you been good this year?
And so do day-to-day cared for patients like Michael. If the potential cuts that affect him go through, his father worries for what could lie ahead.
I mean, what will you do? Who will take care of it? I have to do it, and I won't be able to work. I won't be able to make my payments, and I won't be able to pay the bills. I mean, everybody loses all around.
Now, the cuts also affect infant births. Right now, more than 50% of births in our state are funded by Medicaid. For a full list of how many people all of the cuts affect in our area by county, visit our website, scnow.com. Live in the studio, Mason Snyder, News 13.